Rehab Online presents video. PNF technique. Rhythmic initiation. Objectives. Rhythmic initiation is a technique that focuses on improving mobility that is impaired by deficits in movement initiation, coordination, or relaxation. This technique can be used successfully with any pattern or activity, particularly as a teaching tool. It is frequently used with lower-level functional tasks, such as rolling. Patients with hypertonicity who have difficulty initiating functional movements are especially appropriate candidates for this technique. This technique involves sequential application of first passive, then active assisted, then active or slightly resisted motion. Passive movement is used to encourage relaxation and teach the movement or task. Once relaxation is achieved, the patient is asked to assist. The clinician constantly monitors the patient's movement strategies. If appropriate recruitment patterns are noted, the progression continues such that manual contacts remain in place, but no assistance is provided by the clinician. Slight resistance may then be added to promote further muscle contraction and reinforce the movement pattern. Example: rhythmic initiation may be used successfully to promote efficient patterns of rolling. The patient begins supine with the head turned toward the side to which he or she intends to roll. The upper extremity on that side is prepositioned so that it is away from the body. The therapist passively moves the patient into a side-lying position using manual contacts on the trunk and extremities while asking the patient to feel the movement. The clinician then asks the patient to move toward the clinician's manual contacts. The goal is for the patient to continue to increase motor recruitment and desired movement. Facilitatory manual contacts remain in place, but assistance is gradually withdrawn. When appropriate, the clinician may apply slight resistance to the rolling movement through manual contacts on the trunk or extremities. Demonstration video.
We are going to demonstrate rhythmic initiation for the upper extremity. Rhythmic initiation is essentially a four-step process. You're going to be instructing the patient first passively, so you're going to perform essentially passive range of motion in that pattern, followed by active instruction to the patient to help and participate and performing it as an active assistive range of motion activity. Then you'll follow up with active range of motion, having the patient perform that pattern on their own. And then lastly, applying resistance. Now remember, when you get to that last piece and you're applying resistance, that your hand placement is going to be very critical. You don't want to confuse the patient, and you want to only elicit contraction on the desired muscles. So you want to make sure that your hands remain on one side of the joint or one side of the extremity so that they're only pushing in that direction. Your hands are essentially going to be your communicator or talking with the patient. So you need to provide very simple and clean instruction, both verbally and with your hands. Diana, we're going to bring your arm up. Remember to open the hand, follow with your eyes. Good. Okay, I'm just going to show you that again. This is the motion. Follow with your eyes. Good. Now I want you to help me perform that motion. Just help me do that. Good. Okay, I'm going to let you do that on your own. Okay, turn that hand. Good. Follow with your eyes. Okay. Now I'm going to give you resistance this time, so you're just going to fight me. Push into my hands. Push, 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 push. Good. Okay. That is rhythmic initiation.
Thanks for watching.